Asthma talk number 5. How then do we diagnose whether a person really has asthma? As we mentioned before, symptoms of chest infections and coughs and colds can be similar to symptoms of asthma. However, if we have a patient who recurrently gets symptoms of asthma, particularly with the pattern that we mentioned in the previous talk, where it varies according to the time of day, worse at night and in the early morning, and if it varies in response to certain triggers, then we would be interested in confirming whether the patient truly has asthma or not, because this makes a difference in terms of how they would be treated. The diagnosis of asthma is something which is done by doctors and nurses using equipment to measure the patient's breathing. The breathing techniques are all painless and often can be done at the GP surgery, although hospital doctors will do them as well in respiratory clinics. And they essentially involve the patient blowing into a tube. The simplest form of doing this is to blow into what we call a peak expiratory flow meter, and many patients will have been asked to do this either as children or as adults. And it's a simple tube that the doctor can provide with a white disposable tube at the end, which gets thrown away after each use, and the person blows into that, and you can measure um, the strength of the person in blowing out, and the person's lung strength, if you like, putting it very simply. There are more complicated ways to describe it. Um, uh, the the peak flow, as we call it, is a useful measure, but it's perhaps not the best way of doing checking for asthma. And a more sophisticated test, which also involves blowing into a tube, is called spirometry. Many GP surgeries now have these, so a person who is looking to have asthma diagnosed need not necessarily always have to go to hospital to have this done. Spirometry also involves blowing into a tube, and the spirometer is attached to a computer which gives quite sophisticated readings about how much air the person has blown out in 1 second, and various other measurements which the doctor can then look at and decide what the disease process is going on in the lungs. There are other conditions, particularly in adults, which can resemble asthma, and these can be distinguished by use of the peak flow, or in particular the spirometry. There are blood tests that can be done, and also the sputum of the person, the mucus of the person can be done, but these don't necessarily confirm asthma. In general, the way to diagnose this is through seeing the doctor or the nurse in the GP practice, where they will get you to do a peak expiratory flow or a spirometry test, and they may get these repeated, um, uh, especially if they give certain medicines which work for asthma, to see if those medicines have any effect on the patient before and after taking the medicine on their peak flow reading or their spirometry reading. They may also give a peak flow meter for the person to take home and take measurements at various times of the day to see if there's any pattern. But normally these are the common and simple ways of diagnosing whether a person has asthma.